Hello everyone, this is Dr. Juwan from Total Health and Wellness Center. What I'm going to talk about today, I'm going to talk about the two most abundant minerals in our body, and that's magnesium and calcium. I'm going to go with magnesium first, and then I'm going to double back and do calcium, okay? Because they do work together. Now, magnesium, let's start with magnesium. Magnesium is the 8th most abundant element in the Earth's crust, okay? And approximately 50% of the total body magnesium is found in the bone. And the remaining, and only 1% of magnesium is found in the blood. So the body works very, very hard to keep the blood levels of magnesium constant. Okay, it has a lot of functions. One, it helps regulate blood sugar levels, promotes normal blood pressure, and is known to be involved in the energy metabolism and protein synthesis. Now, the key thing about magnesium, it's involved in over 300 chemical reactions throughout the body. So in times of stress, in times of anxiety, in times of malnutrition, magnesium is very, very important to maintain the body's what's called homeostasis. It helps maintain normal muscle and nerve function. It keeps the heart rhythm steady, supports a healthy immune system, and keeps your bones strong. So magnesium is very, very important. It's a mineral just like calcium, so it can be absorbed, so it must be absorbed through dietary intake. And the question is, where do we get magnesium from? The first and foremost, the key is the green vegetables, such as spinach, broccoli, okay, any of those vegetables, because in the center is called the chlorophyll molecule, which gives the vegetable its color. Other ways to get magnesium, legumes. This is your beans and peas. Nuts and seeds. Now, when it comes to nuts and seeds, I always recommend the almonds, the walnuts, the cashews, the pecans, because remember, peanut is not a nut. It's actually a legume, but however, because it grows outside the ground, it is covered with a lot of the pesticides, insecticides, a lot of the stuff that's being sprayed on it. So I highly don't recommend that you get your magnesium off the peanut. Go with the almonds, pecans, cashews, and those nuts for your magnesium intake. Unrefined grains. Now the key word here is the unrefined grains. Not the refined grains, the unrefined grains. And also too, the tap water. Now I'll get into that later because it varies according to the water supply. Now, how much magnesium should you take? It varies. Now again, this is the minimal amount of magnesium required by the RDA. So adult men from 19 to 30, you're looking at the minimum amount of 400 milligrams per day. 31 years and older, you're looking at 420 milligrams per day. Now, for the females, adult women between 19 to 30, you're looking at 310 milligrams per day. But the females 31 and older, you're looking at 320 milligrams per day. Now, again, I recommend this is the minimal amount that you need. Now, the key thing is, with magnesium, it's a very, very fragile mineral, and in times of stress, our body burns through it very, 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 very fast. So I always recommend upping your dosage. So what happens if you have a deficiency? It's called hypomagnesemia. So what happens, this results in low blood calcium levels. Now, calcium and magnesium, they work together hand in hand to maintain the blood levels. So what happens if you have low in one area, you may have high in the other, or if you may have low in one area, you may have low in the other, because they both are used together throughout the bloodstream. Because remember, a very, very small percentage of calcium, and also to magnesium, is floating around the blood. So what happens if you have a deficiency of magnesium? This is where the muscle cramps, the spasms or seizures, restless leg syndrome, nausea, weakness, irritability, and confusion. Because remember, magnesium is needed in over 300 enzymatic biochemical reactions throughout the body. What happens if you're chronically low in magnesium? You're looking at chronic diseases such as heart disease, high blood pressure, osteoporosis, and type 2 diabetes. The early signs of magnesium deficiency that I've noted with my patients is loss of appetite, nausea, vomiting, fatigue, and weakness. So here's some fun facts. So when I talked about the water, now hard water contains more magnesium than soft water. And if you're craving chocolate, now again, this is not dark chocolate, this is your milk chocolate. Take some magnesium, it'll help take the cravings away. Okay, so now let's go over to the other side, the B side, calcium. Calcium and magnesium, they work together to maintain our body's homeostasis. Now, the thing about calcium, it's the most abundant mineral in the human body. Now, more than 99% of the total body calcium is stored in the bones and teeth where it belongs, okay, to support their structure. So the remaining 1% is found throughout the body in the blood, muscle, and the fluid in between cells. So when the blood calciums go low, this is why it's very, very important. It's critical for the transmission of nerve impulses. Calcium flows into the nerve cells and stimulates the release of molecules called neurotransmitters. Now, what happens in order for the nerve to switch on, I always say that calcium is the spark plug that is needed to create the reaction. Okay, so if you're low in calcium, this is where you can have chronic conditions. It plays a key role in muscle contraction, healthy blood pressure, the initiation of blood clotting, and the regulation of various hormones and enzymes. Like magnesium, calcium is needed for the normal body's homeostasis. So the thing about calcium, it cannot be synthesized, so you do need to take it in from other sources. You must absorb calcium every day from your dietary intake because your body does not make it on its own. Now the question is, well, where do I get my calcium? Because I highly recommend for my patients not to take it in from the dairy sources, because the dairy sources are laden with chemicals, GMOs. You're talking about estrogen pumps, growth hormone, antibiotics. So the calcium that's taken in from the cows is not even utilized. So the other ways to get calcium is through the raw milk. Again, this is an unpasteurized raw milk. Kale is loaded with calcium. Sardines loaded with calcium. Yogurt or kefir loaded with calcium. Broccoli loaded with calcium and magnesium. Watercress, cheese. Now again, this would be like the organic cheese. This is not the cheese that you buy off the store shelf. Or bok choy, okra, and almonds. Almonds, as well as magnesium, are loaded with calcium. So almonds is definitely a good recommendation, I always say, for calcium intake. So again, the minimal daily requirements, males and females between 9 and 18 years old, you're looking at 1,300 milligrams per day. Again, this is the minimal amount. Now, don't forget, if you go below the minimum amount of calcium, then you're going to have a lot of reactions. Okay, a lot of symptoms, just like magnesium. Women and men between the ages of 19 to 50, you're looking at 1,000 milligrams per day at least. Pregnant or nursing women, you want to up that to about 1,300 milligrams per day. Men and women over the age of 50, you're looking at least, again, the minimum amount is 1,200 milligrams per day because it's good for the heart contraction, it's good for nerve impulses. So you want to take a minimal of 1,200 milligrams per day. Now, what happens if you have a deficiency in calcium or low levels of blood calcium? You're going to have osteoporosis because, again, calcium is needed to help build bones. And magnesium piggybacks on calcium to help absorb into the bones. So if you're low on calcium, this is where you open yourself up for bone fractures, convulsions, muscle spasms, heart failure, and bleeder's disease. Now, bleeder's disease is, because calcium is needed for blood clotting, this is where you're going to have a slow clot, and you may, again, or increased bleeding time. So now, let's go backwards a little bit. Let's talk about the different types of magnesium, because this is the critical question that I get from my patients a lot. There are different types of magnesium, and they're based on the bioavailability, but also, too, they're based on the absorption, how much is absorbed into the bloodstream. Now, the best way to take magnesium is on an empty stomach. So let's start off with magnesium citrate. Magnesium citrate is the most common that's out there. You go to any of the stores and you look at the label, and magnesium citrate is the most common one. However, it is not the most absorbed magnesium out there. And what happens is that if you take too much magnesium citrate, this is where it's also used as a laxative. So this is where you may get diarrhea or lose stool by taking too much magnesium, and there's a fine line. The best one is this. I always recommend magnesium chelated and magnesium glycinate. This is the best absorbed, okay, in our system. It's best for mental calming and relaxation. Now, when I'm talking about relaxation, I'm talking about like a muscle relaxation. If your muscles are too tight, it helps relax the muscle. Okay, so you look at the magnesium chelate and magnesium glycinate. Now, magnesium oxide, this is the least absorbed, okay? But it has the highest percentage of magnesium per dose. And what happens, so this is the least absorbed in your system. So if you're looking at a way to throw away your money, this is the one that is, you're just really just, I'd rather have you just throw away your money altogether, okay? Because you're not even absorbing the magnesium you're getting. And or since you're not absorbing it, this also too has the highest laxative effect as well. Magnesium taurate. Now this is a less common form. It is taken specifically for cardiac conditions and heart function in general, because magnesium helps regulate the heart rhythm, as well as calcium, but magnesium does as well. It helps heart muscle relax, as well as the blood vessels that feed the heart to open and deliver more blood to the heart itself. So this is the best magnesium that I always recommend, magnesium taurate, to help regulate blood pressure. Okay. Then there's a magnesium sulfate and magnesium chloride. These are your topicals. Okay. Typically used, again, magnesium sulfate is best known as the Epsom salts. So when you have your Epsom salt bath, this is why you feel so relaxed after an Epsom salt bath, which, because it's relaxed, it pulls it out. Since you're relaxed, I always recommend definitely taking a glass of water after you get out, just so you're not dehydrated. Again, the baths can help to lower the high blood pressure and reduce stress levels because, again, the magnesium sulfate gets absorbed into the cell, helps relax the heart tissue. And the chloride is the most common in lotion, gel, and oil preparations. Okay. So there's also this new one. It's magnesium L-threonate. It's a newer player on the magnesium front. Okay. This form effectively crosses the blood-brain barrier, which is good and has been recently studied for use for patients who have Alzheimer's or other forms of cognitive decline. This is the one that's most commonly used. It's most beneficial. Okay, so now let's talk about the types of calcium. We talked about the types of magnesium. Let's talk about the types of calcium. So first of all, the calcium salts contain the same amount of elemental calcium. Okay. However, elemental calcium is the amount of calcium actually absorbed. So again, you may have a lot of calcium in your supplement, but you're not absorbing it. So you want to look for the absorption rate versus the amount. So for example, there's more elemental calcium in calcium carbonate than in calcium gluconate. However, your body may not be able to absorb it as well. So again, make sure you read the labels before you take it. So let's first of all talk about the worst type of calcium you could take, and this is calcium carbonate. Okay? It's the least expensive and it's the most common. However, it's an alkaline-based compound found in rock, limestone, and shells of marine animals. Basically, what that says is that if you're going to take calcium carbonate, it's going to cause your muscles and your systems to be much more harder. It's like stone. So this is one way I always recommend, do not take the carbonate. Now, calcium citrate, I veer more of my patients towards because it's most preferred. And that's my dryer. So anyways, it's very well absorbed and tolerated by most people. It has been proven to help bone density and may help to prevent kidney stones. So I always recommend calcium citrate over anything else. But you have a calcium gluconate, calcium lactate, and calcium gluconate. Like it's a double print there. They have very low levels of actual calcium in each supplement tablet. So therefore, it's necessary to take a large amount because again, you're not absorbing the amount of calcium that you should. Next, we have what's called calcium citrate malate. Again, it's a combination. It's a water-soluble form of calcium. So this is actually pretty good. It has higher levels of bioavailability than the others because it's water-soluble. However, it's not a bad choice if money is a problem. I always recommend this brand if the money's kind of tight. So then you have the calcium ascorbate. It's not easy absorbed as a citrate form, especially if you have low stomach acid, as most people do. So what happens, there's no really good reason to get this over the other alternatives. So I hope you enjoyed the magnesium and calcium. Thank you for watching. My website is www.totalhealthdupage.com. Please share this video with a friend if you like it. Please like my page and take care. Thank you very much for watching. Hello, this is Dr. Jawad. Please subscribe to my channel for more up-to-date videos. And thanks for watching.